Welcome everyone to one of EMIC's Innovation Spotlights, Ring Rescue. I'm here with Kevin Spencer, the co-founder and CEO. Ring Rescue is focused on solving the common issue of ring entrapment, which can escalate into ring tourniquet syndrome, a finger-threatening emergency. Their patented products are currently being used in 1,500 hospitals across North America, changing lives across the continent. Today, we'll dive into how Ring Rescue was built and the lessons Kevin learned along the way, especially for those of us aspiring to be innovators ourselves. Kevin, we're thrilled to have you. Welcome.
Sorry, the audio just broke up for a second. Apologies. Was there a question there?
No, I'm just saying we're thrilled to have you.
Oh my goodness. Yeah, no, thank you for having me. It's great, honestly, to be here. I actually got to meet some of the EMIC folks at ASAP last year, and it's been really, really cool to follow what you guys are doing as well.
Awesome. I'm glad to hear. So, I'd love to start with your origin story with Ring Rescue. Could you walk us through what inspired you to create your company?
Yeah, sure. So in modern healthcare, so what if I told you that there's a common clinical condition that's more common than appendicitis and kidney stones combined that can escalate into a time-sensitive emergency with the potential for irreversible finger damage? And so, of course, I'm talking about ring entrapment. And it's interesting that over 55% of US adults wear rings. That's not really surprising when you look around any given room. A lot of people wear rings, and that's actually more than like 150 million people across the United States. What is quite interesting is that 70% of those ring wearers have actually reported having a stuck ring experience in the past. And of those, 26% required healthcare intervention. So there's a lot of people going to healthcare for stuck rings. And modern rings are increasingly made from durable materials like titanium, tungsten carbide, stainless steel. And in fact, traditional metals like gold and silver and platinum actually now account for less than half of rings worn. So, so fingers swell for all kinds of reasons. As ER physicians, I think we've probably seen that injury, illness, fluid shifts, and when that swelling worsens, a stuck ring can escalate into what's called ring tourniquet syndrome, which you introduced. And that, of course, is a time-sensitive and finger-threatening emergency. And so then with that, and this is where it really gets bizarre, what if I told you that healthcare professionals are still treating this condition using repurposed hardware store tools like Dremels and bolt cutters right at the bedside? And it's sometimes seen as clever, but objectively, it's a dangerous procedural blind spot in modern healthcare. And these improvised tools were never designed for patient care. They expose patients to harm and providers to liability. And so, as both an emergency physician and a mechanical engineer, I saw this as an opportunity to, I guess, to elevate care and solve a common problem and restore medical standards where they had quietly eroded along the way. And so I've managed countless stuck ring cases over the years myself. And when those rings are made of modern materials, legacy can opener cutters simply don't work, and you're left with nothing but improvisation. And so I couldn't believe really that I guess that this blind spot still existed. And so we built a company and decided to fix it. And that's what inspired Ring Rescue.
Yeah, awesome. Would you say that this was the clinical gap that you were seeing that made it feel urgent or necessary?
I mean, like ring entrapment is common. I think probably what made it urgent was how unprepared we were to deal with it, especially as ring materials evolved. And as I mentioned, those legacy tools like the old can opener style ring cutters, they're actually built for gold and silver. Like they worked around the rings that were available when they were built, but they simply can't handle modern rings made of, titanium, tungsten, stainless. And yet those kinds of rings are now the norm. That's what people wear. And there's new emerging trends like titanium constructed smart rings, which have batteries in them that are increasing popular. So rings keep changing. And what happens if the ring won't cut, the finger keeps swelling and care escalates. You end up with patient delays, you end up with failed attempts, unnecessary transfers, and in some cases, surgery and serious harm. And so instead of modernizing, we as medical professionals started improvising and string wraps and Dremels and bolt cutters and vice grips. This kind of became routine, I guess, and that routine created risk. And a recent case is actually a really powerful example of what happens when this clinical gap goes unaddressed. So there was actually an 11-year-old girl in Georgia last year. They got her friend's ring stuck, kind of a common, starting point of this story. And she went to the emergency department where traditional ring removal methods failed. and actually made the swelling worse. And then came in the improvised tools. A Dremel was used. The ring heated up. Her finger got burned. She's basically crying as staff struggled, eventually transferring her to a second hospital, a pediatric referral center. And after 6 hours, combined two hospital visits, she's actually now facing a hand surgery consultation. And the really, she was had a real fear that she might actually lose her finger. And so this case escalates to that point with an 11-year-old, and an EMS supervisor steps in who happened to be on site for unrelated reasons. He happens to have our product at his station, so he gets our dolphin ring cutter, and within minutes of returning with our kit, the ring was cut off, circulation was restored, the case was resolved, and that moment kind of captures a pretty compelling storyline, which is, for the patient, for the family, for the team involved. Um, Really, I mean, that case actually earned that EMS supervisor a State of Georgia award for excellence of pediatric care. But that level of care came from having the right tool at the right time. And that I think that single case kind of tells you about the gap where hospitals weren't equipped, improvisation caused harm, and healthcare professionals with the right tool were able to solve it safely, definitively, and within minutes. And so, the gap isn't really, I guess, just about equipment. I really think it's more about preparedness, modernization, patient safety, um, like reestablishing medical standards, and I guess eliminating the quiet normalization of improvised care in healthcare. And so, yeah, the clinical gap urgency, I guess, is kind of driven by that bigger theme.
Yeah, and as you said, to accomplish all of those things, having like the right equipment and equipment that works well is super important. So while you were developing Ring Rescue, what were some of the biggest challenges that you faced while developing it?
Yeah, great question. I think there's a couple directions. There's the technical challenge. There's the challenge around building a company. But when we talk about developing the device itself and the technical side of that, so our solution, our company Ring Rescue, we have a product kit called a Ring Rescue Kit, and that includes two core medical devices. So one is the Dolphin Ring Cutter, which is an electrically powered ring cutter, and the other product in the kit is called a compression device, and that's essentially a finger shrinker to make fingers skinnier so you can get rings off without cutting them. And both of these products are medical devices. They're both very different. The Dolphin Ring Cutter is our power tool, and it cuts titanium and tungsten. It cuts basically every ring metal safely without heat. And so on the outside, it looks sleek and simple, but under the hood is actually quite sophisticated. It's computer controlled. It's a medical device. It has integrated hardware, software, electrical engineering working all together in real time. And in healthcare, that complexity is essential. It's also driven by standards. And so, it's not just enough for a tool to simply work. It has to meet essential performance and patient safety standards to become regulated in healthcare space. And that actually shapes every part of the design process as well. So that's important to know in the medical space. And it's good. Like these are good standards. They create good products. And there's a reason that medical devices are intended to stand apart from, consumer products. And so, for example, I mean, we had to account for medical grade batteries and electrical design around medical standards. We had to have real-time feedback control for heat, so you don't have ring heat buildup. And that's really interesting how we solve that, and it's great. We have to deal with things like electromagnetic interference testing so that our product can safely coexist with other clinical equipment. Um, Shocks like the electrostatic shocks and discharge, like these are things you don't normally think about, but these are all part of the design process that just is embedded in it. Cleanability standards, even medical labeling standards for indications for use for types of labels. Like, not surprisingly, there are standards around all these things, and the standards exist for good reason. And so there's definitely a bit of effort and challenge to solve a clinical need that's identified, but also embed all these additional needs around design in the process. And that sounds like a lot, and it is a lot, but it's doable. Like the standards exist, you can read them, they make sense. And as you are thinking about designing a medical device product, just know that this is out there. No, it's going to be complex, but it's doable, and it creates better products in the end. So don't be scared of it. Just dive into it. Um, Now, the compression device follows the same logic. So that this device, it applies essentially uniform controlled pressure to reduce finger swelling, and that enables what we say non-destructive ring removal, or allowing a ring to be removed without cutting when feasible or when possible. And that replaces improvised kind of life hacks with string wrap methods and dental floss and that kind of stuff. And those techniques can actually cause micro trauma because you're wrapping something around a finger tightly. And if you wrap it too tightly, you can cause a little bit of uh, tissue damage that can worsen swelling. And so when it comes to the compression device, the design around that looked at what's safe pressures for fingers, safe compression times, how do we shrink a finger without causing damage? And that's in the kit as well. So these two products together make up the Ring Rescue Kit, which is intended to be like a for purpose comprehensive solution for ring entrapment, the problem. So yeah, the first challenge was technical and regulatory, and we had to design and test and validate around that. And that certainly took time and resources. And once we got there, the next challenge is really on the business side, and that is building a business and driving awareness. And the reality is not everybody knows that this blind spot has been solved. Adoption takes time, and it takes education, and occasionally we encounter resistance, especially from institutions that still consider, I guess, legacy or improvised tools as being good enough. But the clinicians on the ground, when we go to trade shows and ASAP and meet people, I feel like once clinicians see the product in action, they try it, they cut a ring, the response is consistent and positive, and I'm really proud that we solved a common clinical problem. Um, yeah, so while development was primarily like an engineering challenge, the ongoing work around, I guess, modernization is is ongoing, and I think helping healthcare systems recognize that improvisation is no longer necessary and certainly not acceptable as a standard of care is part of the next phase of the challenge. And we've built a solution.
Awesome, yeah, and I can definitely imagine that before distributing the product, it took like a lot of rigorous testing. And so once you felt like you had a product that you were ready to distribute, um, what was it like to get it to institutions and how has the response been from them?
Yeah, so there's different channels to bring medical devices to end customers, distributors going direct. We've tried a variety of different ways. It's complex, but there are good distributors that exist out there, and we were able to find a group of distributors that are, um, uh, I guess, organized around bringing novel products to market. That's kind of their specialty. So they're specialty dealers that work on bringing new products into emergency care, and that's been great partnership. So we really like working with them, and there are networks of these distributors out there that are, if you have a product that's a fit, that's a great way of getting it out there. In terms of the response from providers and institutions so far, I mean, it's been really encouraging and really validating for us. As you noted at the beginning, we've now deployed the Ring Rescue Kit to over 1,500 clinical sites across North America, and that includes most of the top hospital names like Mayo Clinic, Cleveland Clinic, Mount Sinai. If you look at the US News top 20 hospital list, like our products are in all of them, which is I'm really proud of that. And I love that these top names, by the way, are also early adopters of good technologies. It kind of reinforces their brands, in my view, in a lot of ways. And so, that's been really rewarding, but also the range of adoption. And so emergency departments are definitely where our core market is. I'm an ER physician myself. And I believe every emergency department should be prepared with tools for ring entrapment, like every single one. That's my belief. I think that's a valid belief. But I also think that EMS systems, fire rescue teams, urgent care centers, and even correctional facilities and jewelry stores and other places see ring entrapment fairly commonly. And and so that range of adoption is really interesting because we're selling outside of just ERs. We are selling to fire rescue and EMS quite and urgent care quite heavily, and we're building into correctional facilities where inmates have to get their rings off before you go into jail, and that becomes a problem when these rings are stuck or tight. And so it's surprising how some of these side verticals reveal themselves along the way that you wouldn't necessarily think of. And what resonates with providers, I think, isn't just that it's a tool, but it's a comprehensive solution. The Dolphin ring cutter, of course, gives like a definitive way to cut even the toughest ring metals. So you have a solution to get this ring off. safely within a number of like within under 10 minutes, basically. The compression device as an additional tool, I think is really great when there's sentimental rings or expensive rings or when the patient preference is really to try to get this thing off without cutting it. It provides a nice option. And so together we solved the whole problem. And I've heard from clinicians that who used to dread stuck ring cases because they felt like they were getting into a can of worms and they didn't feel equipped and they used to dread it. They didn't want to use a Dremel, that they're confident with our solution. They're happy they have it, and we're hearing great feedback. And as the co-inventor of the product and co-founder of the company, I really like hearing that. It's super validating. So whether it's that type of feedback or the case from Georgia that we talked about, this is the kind of impact of why we built this. And so yes, the response has been strong, and more than that, I'd say it's even been grateful in some ways, which is really cool. Because I think we're solving a real problem.
Definitely. And as Ring Rescue continues to expand, what do you think it'll take for Ring Rescue to become the standard of care?
Yeah, the standard of care is I guess in a lot of ways, it's already started to shift. As I mentioned, we have over 1,500 clinical sites, including the top institutions. And, to get us to become recognized and expected as the standard of care, we need institutions to align with what healthcare providers, ER docs already know is that improvisation is no longer acceptable and regulated medical tools are now available. So consider this scenario. I mean, from a standard of care perspective, this also bridges into the medical legal side of things. And so let's say a healthcare professional advocates for a product, but their hospital's procurement process resists. And a ring entrapment case arises, like that Georgia case, for example. A Dremel is used, results in finger injury. Let's just say the patient sues, and their lawyer argues that a made-for-purpose, FDA-registered solution is readily available. They point to the Dremel's own product manual, which explicitly warns not for medical or dental use serious personal injury may result. That's a quote from the manual. At that point, the decision to use a hardware store tool becomes largely indefensible and it may constitute malpractice. And this is entirely avoidable for everybody involved, including the patient who has sustained this injury. So when it comes to standard of care, um, there are not many medical solutions available, and improvised strategies, I think, are arguably not meeting a medical standard of care already. So, our devices are safe, medically certified, and already widely adopted. So, I would humbly suggest that the standard of care has already been elevated, and and now it's time for healthcare institutions to ensure that their teams are supported with the right tools. And whether it's a point of care ultrasound or a ring rescue kit or any other clinically validated technology, frontline care depends on having the right equipment before the moment arrives that you need to use it. And while we've seen meaningful progress in emergency departments and hospitals, I think that the next major evolution in standard of care awareness actually lies within fire rescue and EMS systems. Um, because I think this procedure is treated more like a rescue procedure than a medical procedure, which it is. I mean, ring entrapment and ring tourniquet syndrome, these are medical problems, and ring cutters are FDA regulated medical devices. And so I think that is the next major evolution. I think in the hospital side, um, standard of care, certainly, I think there's an argument to suggest we probably are that, which is pretty cool.
Yeah, and that's amazing how there was such a big need for a product like Ring Rescue, and how you went through all of the aspects required to develop a product and really solve that problem. So, what advice would you give to other clinicians who are looking to create their own healthcare innovations?
My biggest advice is to start with a real problem, something that you've faced firsthand at the bedside, something that's frustrating, something that's unsafe, something that hasn't changed in decades and clearly should. And I think that lived experience is your biggest asset as a healthcare professional looking to get into the innovation side. I think it gives you clarity and conviction and credibility because you know the space and you see the problem and you understand it. And I think once you've identified the problem, the next step is building the right team And for me, that meant partnering with engineers. I mean, I'm a mechanical engineer myself, but building the team out with the right partners, with engineers for the technology development side, learning about the regulatory side of things, understanding how to commercialize within healthcare. And you don't need to know everything for sure. Like you won't, but you need to be willing to learn what you don't. And that learning journey is really fun. It's great to learn and explore this side of medical care. And so I would also expect it to be hard. It's going to take more time. It's going to take more money and energy than you think. You're going to hit dead ends. You're going to have to pivot, and you're going to face moments where perhaps others don't see what you see quite yet. But I think there's deep fulfillment in solving even one problem really well. And more than ever, there's a growing community of clinicians and innovators, medical entrepreneurs, folks like yourself, like your organization, who want to help, and groups like EMIC, medtech incubators, physician founder networks. I think they're opening doors that used to be closed, and the community's collaborative. I'm actually wearing a scrub top right now, which has my name on it here in Ring Rescue. Um, and so this is actually a scrub top company that was invented by an ER doc, and a collaborative thing. I just want to use that as an example that whether you're creating a new scrub company because you want something comfortable to wear at work, or you're creating a solution to ring entrapment, or you're looking at AI technologies to solve any number of wonderful solutions it can provide us in the future around healthcare needs. Um, I guess if you're thinking about it, take that first step. You don't need to know how it ends, because healthcare needs more people who can see what's broken and are willing to fix it.
Yeah, awesome. And thank you so much for talking about Ring Rescue today. I think we were all able to learn a lot about what it takes to create an innovation that's just as scalable and as important as Ring Rescue. So thank you so much.
Yeah, thanks for having me. I really appreciate it, and I look forward to seeing when this comes out. I can't wait to share this.
Yes, of course.